My highlights of the nursing course are being able to be on placement and learn practical skills in a realistic setting.
In your first year they send you out pretty much straight away inside 6 weeks to work in a hospital on a ward and in a ward environment, and it's nice to be able to take the skills that you've learned and pretty much put them into practice straight away.
Because when you walk onto a ward, people recognise you're a King's student and recognise that you're a higher standard than other people, which is what's perfect about being a King's nurse.
We have students who come from all manner of different kinds of backgrounds, a number of whom have already had very successful careers in other areas. We have one very distinguished alumna, Janet Pilgrim, who won the Royal Red Cross last year for her work in Iraq and before that in Afghanistan.
When I'm outside of the classroom or outside of the hospital environment, I play rugby. In my second year, I ran for president of the rugby club and managed to secure it. So there are ways to take on extra responsibility and help out the college.
The Prime Minister, in his previous role as Chancellor, came to visit the school, and he mentioned the school in his first speech on health, which he chose to launch from King's, and he had an audience with our students afterwards who lobbied him very heavily on student support for diploma and undergraduate degrees. Becoming a nurse or a midwife, I believe, is one of the most stretching and challenging experiences that anyone could ever encounter.
There really is a kind of huge and wide-ranging opportunities once people qualify, and I think especially once people qualify from a university that has the reputation that King's does.
I've got a job already, even though I'm not quite finished yet. I actually got more than one job offer because people want King's nurses. I'm also hoping to come back and do my Masters at King's. I don't want to go anywhere else to study.